Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Brittany Bond. Welcome, Brittany.
Thank you so much.
And Brittany's with Helping Hands. And you're a nonprofit that survives a lot of times. Survives not be too strong a word, but you rely on volunteers, and it's volunteer month.
Yes, it is, and rely is an excellent word to share about with our volunteers. So at Helping Hands Clinic, we have a staff of about 9, and we have about 50 volunteers who support our work and help keep us from, running around with pulling our hair out and not being able to get everything done. So we're incredibly blessed by their time and their energy and their ideas and their support. And last year, our volunteers provided about 1,200 hours of service at our clinic. Primarily, you'll see our volunteers in the pharmacy and manning the pharmacy window. So if you come in to pick up a prescription in the afternoon, you're most likely going to talk to a volunteer first, which is pretty wonderful. We're well supported by the ladies in the Lenore Service League. They keep a schedule where they come out and work at our pharmacy window and help us out, and we're just incredibly grateful.
Now, when you say work at our pharmacy window and in our pharmacy, like all these red flags go off in my head, because I'm like, what kind of special training do you need for that? And would I, as just a regular person, be qualified? So speak to that a little bit.
Oh, yes. So everything that requires special licensure or certification or training is done by our staff and by our pharmacist in charge. So what our volunteers do in the pharmacy is, after the medications are dispensed and ready to go and ready for our patients, they just check the medication out for the patients, which is really great. So you get to have a little bit of patient interaction. You get to check in on people, see people that come in every month and come and get their medication, and it's a pretty simple role. We have volunteers who help in other aspects of the pharmacy, but again, it's always under the supervision of our pharmacy tech or of our pharmacist.
And I will say, probably a year or more ago, we visited your pharmacy, and it's like amazing how it's so well organized. Like, the layout is perfect, and I don't know if the medications were in alphabetical order or what kind of order they were in, but I was like, they seem very easy to find for folks.
Yes, it is. And our pharmacy manager, Wendy, runs a really tight ship and keeps everything very organized. And our pharmacist in charge is there every day and double checks and makes sure everything's, all the T's are crossed and all the I's are dotted and everything moves along well in the pharmacy. So all the volunteers have to do is come and help be our smiling faces.
That's pretty helpful. What else do your volunteers? I mean, I know you have volunteers in other capacities.
Oh, yeah. So we have volunteers that help us with administrative tasks, that help us with special projects and mailings and all those kinds of fun things. We have several volunteers who help us with community outreach and events and things like that, which is, a lot of fun. And then we also have volunteers who help us in some of our clinical roles. We have a wonderful volunteer who, if we have, one of our clinical staff members is going to be out, she can be our backup medical assistant, and she volunteers her time to do that for us at the clinic and support our team, which is really, really wonderful. So we've also had volunteer medical providers in the past. Right now, we don't have anybody who's seeing patients in the clinic on a volunteer basis, but there have been so many things that volunteers have done. We've had volunteers, a volunteer chiropractor before. We've had a volunteer dietitian who's come and done diabetic education for our patients. So we're just incredibly blessed with the support that we've had, not just to support our mission, but to support our patients.
If someone's interested in volunteering or wants to see if they're a good fit for volunteering at Helping Hands, what does that process look like?
All they have to do is give us a call or reach out. The primary contact for volunteers is our assistant director, Deborah Filial, and all they need to do is just let her know they're interested in volunteering, and she can ask them some questions about what their focus is, and we can find a good place to put them.
And I will say, Deborah is a very happy force and active, so if you call her, she'll have a job for you.
Oh, I have no doubt that she will. And she is the person who can answer any question that anyone has about Helping Hands Clinic. When I have questions, that's who I go to. I go to Deborah.
She's been there for a while.
I think going on 19 years. So,
And I don't even think of Helping Hands as being that old. I mean, in my head, I don't even realize it's been there that long.
I know. We celebrated our 25th anniversary last year. That's pretty exciting.
And just for people who don't know, what does Helping Hands do?
So we are the free medical clinic and pharmacy that serves low-income uninsured adults in Caldwell County. So we do the same thing that any other doctor's office would do. So we provide, we're the primary care provider for our patients. We can do urgent care. We do specialty care referrals, and then we can do labs on site at the clinic. When I say specialty care referrals, any patient who's eligible for Helping Hand services and is enrolled in our clinic is also duly enrolled in UNC's charity care program. So if there are needs for procedures, for special testing, for specialty visits, anything like that that we can't provide on site at the clinic, we have a low cost referral option for that patient. And then the other big piece of what we do is that we are a limited licensed pharmacy, and we can access free life-saving medications, antibiotics, cholesterol, high blood pressure medication, insulin for diabetics. We can access all those things and dispense them through our pharmacy. So we don't do controlled substances or pain medications, but that's just but life-saving medications, antibiotics, and things like that is what we can take care of.
Those medications that people need every day.
Yes, exactly.
That's kind of the way I look at it.
Yes.
It's something that you need every day to stay healthy.
Yes, exactly. That's what we can do.
What if people have medication they would like to donate to you? Let's talk about that.
Yeah, that's a really good question. So we can take some donated medications. If it's a prescription medication, it has to be in date, unopened, and it has to be in our formulary. So what I recommend that anyone does who has some medications to donate is to call and talk to our pharmacy manager, Wendy Baumgartner, before they stop by. So that way, if we can't take it, we can give you some direction on where it could possibly go.
And that's a really good thing, because it may need to go to the sheriff's department or to the police department for Operation Medical Drop.
Yes, exactly.
But if you do have something, it's a good way. If the doctor changes your prescription and you still have an unopened bottle of fill in the blank.
Yes, amlodipine or lisinopril, something like that. Yeah, yeah. We can certainly take those kinds of things. But again, I always say just give Wendy a call first, let her know what you have, and she can give you some good direction on whether or not we can accept it.
You are also looking for CPAP machines?
We are, yes. We have several patients who are in need, and so if anyone has a CPAP machine that they are looking to donate, we can take those right now, and it'll be a huge benefit to somebody who can't afford one.
Is there any other durable medical equipment that you accept?
We do accept things like walkers. Sometimes we can accept potty chairs and wheelchairs and things like that. Crutches, aids like that we can accept sometimes. Again, I would recommend calling, because we don't have a lot of storage for things like that. And if we are in overflow, then we can refer folks to somewhere like Yokefellow, who also takes donations for things like that and can help other folks in the community.
What other services do you provide or have?
Oh, yeah. There are several other things that we do. So our primary services, of course, are our primary care and pharmacy services. Those are the big pieces of what we do. But over the last few years, we've also seen the need for supporting patients with mental health services and also with dental services. We have a mental health program that's in partnership with Broken Arrow Counseling, where we can provide our patients with free counseling services, either on site at the clinic or at the counselor's office, which is actually right next door to us. So that way we can actually coordinate a patient's medical and counseling visits, so they only have to make one trip if transportation is a difficulty for them. That program has been absolutely wonderful. We've received universal positive response and positive outcomes from our patients who have participated. And then also, we have access to a teleinterpreter service, because we have had an increase in the number of patients that we serve who are Spanish speaking. So we can still offer that service through this teleinterpreter program with our counselor on site, which is pretty amazing. So,
that is amazing.
So we can do that not just for our medical visits. So we have a live medical interpreter who's available for all of our medical visits right now. We also have this service so that patients can still have that interaction with the counselor, even if English isn't their first language. And then our dental program, we've recently expanded. We've had a wonderful partnership with the Caldwell County Health Department since 2019, and to be able to offer either low cost or free dental care, focusing on extractions and urgent needs. But in the last 6 months, we've been able to expand that program with some grant funding to be able to offer a more regional service. So we're working with other free clinics in the area, so in the Western North Carolina region, and working with other dental providers as well to be able to offer free extractions, free restorations, so fillings, dental hygiene services, and some limited oral surgery. So we can do that for free for patients who are uninsured and who meet income eligibility requirements. They don't necessarily have to be an enrolled Helping Hands patient. They just have to meet those requirements, and we can start them through that process and get them the dental care that they need.
And dental health, as I understand it, dental health is key to your overall health.
Oh yes, definitely. Your dental health is an indicator to your overall health. So being able to help our patients manage that, and it's also the thing that most people put off until it's an emergency. And so we often have patients come to us with emergencies, and we're able to help them sort of weather that storm and get through that issue if there's an abscess or a broken tooth or something like that. And we have the ability to turn around an urgent patient need within 2 days. So that's pretty, I mean, we're pretty grateful that we're able to do that for our patients.
That's actually very amazing, because I remember a time in the county where that service just wasn't there.
Yeah, yeah. So we're incredibly grateful to be able to offer that.
I have another question in the way people can help. Do you have a wish list for people who might not be ready to volunteer?
Oh, yeah.
Maybe they want to collect things that are on your wish list.
Oh, yeah.
So what does that look like?
Certainly. Our wish list is posted on our website, and our website is helpinghandsclinic.org. And some of the things that are included are like just basic office supplies that helps us at the clinic. Any help that we can have with the the operational expenses that we have is wonderful. But it also includes things like cold medicine and ibuprofen and Tylenol, or over the counter or generic versions of those. But over-the-counter medications, cough drops. Right now during allergy season, over-the-counter allergy medications and Benadryl. Those are really the kinds of things that we take the most. Also things like bandages, Band-Aids, the kinds of things that we can use in the clinic. So I would recommend, if someone's interested in helping us, and wish list items are the way they'd like to go, just check our website. We update that pretty frequently, seasonally, based on what we're needing the most.
And I'm sure the needs do change periodically. Somebody may donate cases and cases of copy paper, so you're good there, but you need something else.
But there's something else that we have a deficit. Yeah, exactly. So.
Brittany, we've covered a lot. We've jumped around a lot.
We have. That's okay.
Tell us where Helping Hands is located and how people can get in touch.
Okay, so we are on Harper Avenue in downtown Lenoir, right across from the St. James Episcopal Church and beside the Wolf Moon Salt Cave. And that's both our clinic and pharmacy. We're kind of right next door to each other. And I would recommend that if anyone has any questions, we are currently taking new patients. We have capacity to serve folks who are in need. And we care for patients who are, and everybody's going to know exactly what this means, patients who are uninsured, who don't have Medicare or Medicaid, and who are at or below 250% of the federal poverty level. And I know that right off the top of my head. I'm sure you do too, Paige.
Oh, yeah. I mean, I just looked at that today. No.
But an easy way to remember that is for a household of 4, that is a total annual income of about $78,000. For a single person, that's an annual income of about $36,000. So if that is you and you aren't eligible for Medicaid and you don't have any other insurance, we could potentially be your healthcare solution.
And when you say that, I think about people who work for small businesses.
Yes, yes.
People who may be in business for themselves.
Yes. We have a lot of patients who are small business owners or who work for local businesses and small businesses who either don't have the capacity to get, don't have insurance through their employer, or maybe can't afford the insurance that's offered through their employer. And so we are an excellent alternative. To be able to provide their health care and have their checkups and have an urgent care resource and get their medications.
Brittany, thank you for what you and your staff at Helping Hands do.
Well, thank you for having us. I've really enjoyed coming and being able to share about what we do and just hopefully connect with people who need us and who we can help in this community.
Great, and thank your volunteers for us.
Of course, always.
Always during April for Volunteer Month.
Yes, exactly. April is the month for me because I have just such a huge heart for people who do volunteer work. I was really lucky to coordinate volunteers for about 7 years in my career in a pastoral, and it was just, that gives me my go juice, is to see people who come and help us meet our mission and help our patients just out of the goodness of their heart. So,
yeah. Thank you. Yes. And thank you for watching Caldwell County Today.